Good morning, everyone. Our discussion for today is about IMRaD, or what we call the introduction, methods, results, and the discussions or the conclusions. Okay. Qualitative journal articles and many qualitative ones typically follow a conventional organization called the IMRaD format. This format, which loosely follows the step of quantitative studies, involve organizing materials into four main sections. We have the introductions, the method, the results, and the discussions. Okay, the text of the report is usually preceded by a title and an abstract and is followed by the references. Okay, the following objective guides me and the listeners for what the study is all about. Okay, to identify and describe the major sections in the research journal article, to characterize the style used in quantitative and qualitative research reports. Okay, IMRAD is an acronym for Introduction, Method, Result, and Discussion. Okay, the IMRAD format is a way of structuring a scientific article. It is often used in healthcare and in the natural sciences. Okay, thesis structured using the IMRAD format are usually short and concise. The language will be as plain and as ambiguous as possible. There is no place in this type of writing for personal views and fanciful language. Okay, make it simple, very short, and very concise. Okay, okay, the title. Okay, the research report begin with the title that um, succinctly conveys. It is typically 15 or fewer words. Okay, the nature of the study. Okay, in qualitative study, the title normally includes the central phenomenon and the group under investigations. For example, of the quantitative or qualitative is the experiences of the nurses assigned at the COVID ward. Okay, in quantitative studies, the title generally indicates the independent and the dependent variables and of course the population. Okay, example of a quantitative study is the correlation study on the mental preparedness of registered nurses to the quality of care to patients at intensive care COVID unit. Next would be the abstract. Okay, abstract is a brief description of the study placed at the beginning of the article. The abstract answers in about 100 to 150 words, okay, with the following questions. Okay, what were the research questions? Okay, what are the problems of the study? Or the statement of the problem. Okay, what methods did the researcher use to address those questions? Okay, like for example, the research design, the data collection procedure, the data instruments you are utilizing in order to answer the research questions. Number three, what did the researcher find and what are the implications for nursing practice? The result must be based on the findings. The result must have relevant to the nursing practice. Okay, readers can review an abstract to assess whether to full or to read the full report. Okay, unfortunately, the strict word counts of some journals make it difficult for the authors to include as much as information in these abstracts as one would like. For the introduction, okay, the introduction should explain what we know and what we are uncertain about. It should explain and summarize, but it should also ask questions, clarify, compare, and etc. Everything you write here must relate to your research question. Okay, this section usually describes the following: the central phenomena, the concept or the variables under study, the study purpose and the research questions or the hypothesis you wanted to be tested, then the review of the related literature, the theoretical or the conceptual framework you will be using, and the significance and the need for the study. Okay, thus the introduction sets the stage for a description of what the researcher did and what was learned. The introduction corresponds roughly to the conceptual phase of the study. Okay, moving on to the method sections. Okay, we're done with the introduction. So now we will discuss about the method. Okay, so you use your method chapter to show that you arrive at your results by applying valid and reliable method. Explain what you did, okay, your research, treatment, and professional intervention, and how you did it. Okay, your method chapter shows how you arrive at your result. Okay, in quantitative study, the method section usually describes the following, which may be present in the label subsections, like the research designs, the sampling plan, and the description of the study participants, the methods of operationalizing variables and collecting data and specific instrument use, the study procedure, including the procedures to protect the rights of the study participants, and the analytic procedure and the methods. Okay, tips. The method section is sometimes called method and sometimes called methods or plural. Okay, either is acceptable. Okay, although the manual of style used by many nursing journals, like for example from the American Psychological Association, says method. Okay, qualitative researchers, okay, discuss many of these of the same issue but with different emphasis. For example, the qualitative study often provides more information about the research setting and the context of the study and less information on the sampling. Also, because formal instruments are not used to collect qualitative data, this is little discussion about specific methods, but there may be more information on the data collection procedure. Increasingly, reports of qualitative studies are included or including descriptions of the researcher's effort to enhance the integrity of the study. Okay, in quantitative studies, the method section describes decisions made during the designs and the planning phase of the study and implemented during the empirical phase. In qualitative studies, the methodological decisions are made during the planning stage and also during the course of the field work. Okay, the result section. A relatively large part of your paper or your thesis should be devoted to your results or the findings, the data, and the empirical evidences. Okay, in these sections, you should present the findings. Okay, organize, classify, analyze, and if relevant, categorize, explain, and of course, interpret. For example, the difference between the various studies and assess and evaluate in the end. Okay, your results is the essence of your paper. Okay, the introduction and the method chapter should build up to your result by showing how you arrive at your results, okay, using your methods and their significance using your introduction. Okay, the results section present the findings that were obtained from the analysis of the study data. Okay, the text presents a narrative summary of key findings, often accompanied by more detailed tables. Visually or virtually, all results sections contain basic description information, including a description of the participants. For example, the average age, the percent male or female. Okay, in quantitative studies, the researcher provides basic description information for the key variables using simple statistics. For example, in a study of the effect of the prenatal drug exposure on the live or on the birth outcomes of infant, the result sections might begin by describing the infant's average birth weight or the percentage who were of low birth weight or under 2,500 grams. Okay, in quantitative studies, okay, the result sections also reports the following informations related to the statistical test performed. Okay, for the name of the statistical test used, the value of the calculated statistic, the significance and the precisions and magnitude of the effects. For the name of the statistical test used, a statistical test is a procedure for testing researchers' hypothesis and estimating the probability that the results are right. For example, okay, if the percentage of low birth weight infants in the sample of drug-exposed infants is computed, how probable is it that the percentage is accurate? If the researcher finds that the average birth weight of the drug-exposed infants in the sample is lower than the birth weight of the infants not exposed to the drug, how probable is it that the same would be true for other infants not in the sample? Okay? A statistical test helps answer the questions. Is the relationship between the prenatal drug exposed and the infant birth weight real? And would it likely to observe with a new sample of infant for the same population? Or statistical tests are based on the common principles. You do not have to know the names of all the statistical tests, okay? Because there are dozens of them, okay, to comprehend the finding. Okay, the value of the calculated statistics. Computers are used to calculate the numerical value for the particular statistics test used. The value allows researchers to draw inferences about the accuracy of this hypothesis. The actual numerical value of the statistics, however, is not inherently meaningful and need not concern you. Next, the significance. Okay, a critical piece of information is whether the results of the statistical test were significant. Okay, not to be confused with the importance or clinically relevant. If a researcher reports that the results are statistically significant, it means the findings are probably true and replicable with a new sample. Research reports also indicate the level of significance, which is the index of how probable is it that the findings are reliable. For example, if a report indicates that the finding was significant at the 0.05 level, this means that only 5 times out of 100, or 5 divided by 100 is 0.05, would the obtained result be spurious. Okay, in other words, 95 times out of 100 similar tests would be obtained with a new samples. Okay, readers can therefore have a high degree of confidence but not totally assurance that the findings are accurate. For the precision and magnitude of the effects, increasingly, there is an emphasis on the reporting not only what the findings are and whether they are statistically reliable, but also the degree of precision around any estimated effects and how seizable the effects are. These two aspects which corresponds to the second and the third questions. Okay, appraising the um, evidence within the evidence-based practice frameworks have not been emphasized as much as this the nursing literature as the medical literature, but this okay situation is changing. Okay, in qualitative reports, researchers often organize findings according to the major themes, processes, or categories that were identified in the data. For example, of the resource sections of qualitative study by Polzer and Miles of the year 2007 undertook a grounded theory study to explain how the spirituality of African Americans affect their self-management of diabetes. One biblical allusions made by several study participants was the body as the temple of God. Some of the men and women in this group stated that the body is the temple of God. A consequence of not taking care of the body is a sin. According to the Betty, age 70 and baptized, okay, it is wrong to eat a piece of cake. God knows that if you know it's wrong, you're sinning. Okay, it's a sin because you're defiling his body. So you're defiling God's body if you don't take care of it. Okay, the result sections of qualitative report sometimes has several subsections. Okay, the headings of which corresponds to the researchers' labels for the themes. Excerpts from the raw data or the actual words of the participants are presented to support and provide a rich descriptions of the thematic analysis. Okay, the research sections of qualitative studies may also present the researcher's emerging theory about the phenomenon under study, although this may appear in the concluding sections of the report. Okay, for the discussion, okay, the researcher draws conclusions about the meaning and implication of the findings. Okay, this section tries to unravel what the results mean, why things turned out the way they did, how the findings fit into the existing evidence base, and how the results can be used in the practice. Okay, the discussions in both qualitative and quantitative reports may incorporate the following elements. We have an interpretation of the result, the clinical and the research implications, and lastly, the study limitations and ramifications for the believability of the result. The researcher is in the best position possible to point out the sample deficiencies, the design problems, the weakness in the data collection, and so forth. Okay, a discussion sections that presents the researcher's understanding of the limitations demonstrate to readers that the author was aware of the limitations and probably took them into account in interpreting the findings. Okay, in this chapter, you discuss the results of the study or the product. Okay, is it possible to generalize or make comparisons with the other studies? Are these alternative explanations? What are the strong and the weak aspects of your paper? What are the practical implications? Is more research needed, or make recommendations to be applied in the practice? Okay, for your conclusions, what answers have you found to your research questions? If you have a hypothesis, okay, has it been strengthened, weakened, or falsified? Okay, do not introduce issues here that have not been mentioned earlier. If the results of your study do not allow you to draw any conclusions, you can end up summing up. Okay, for your reference, okay, research articles conclude with a list of the books and the journal articles that were referenced in the report. If you are interested in pursuing additional reading on the topic, the reference list of the recent studies is an excellent place to begin. Okay, we have a separate discussions about the APA format for your references. Okay, research reports tell a story. Okay, however, the style in which many research journal articles are written, especially reports on quantitative studies, make it difficult for some readers to figure out or become interested in the story. Okay, to custom audience, okay, research reports may seem stuffy and bewildering. Okay, there are four factors contribute to these impressions. Okay, why are research articles so hard to read? Okay, this is because of the compactness, the jargon, objectivity, statistical information. Okay, for the compactness, okay, journal space is limited. So authors compress a lot of information in a short space. Okay, interesting personalized aspect of the investigation cannot be reported. And in qualitative studies, only a handful of supporting quotes can be included. Okay, hindi mo kasi lahat pwedeng i-include to your research proposal. Okay, for the jargon, the authors of both qualitative and quantitative reports are research terms that may seem esoteric. Okay, for the objectivity, quantitative researchers tend to avoid any impressions of subjectivity, and so they tell their research stories in a way that makes them sounds impersonal. Okay, for example, most quantitative research reports are written in the passive voice. Okay, personal pronouns are avoided. Okay, use of the passive voice tends to make a report less inviting and lively than the use of the active voice. Or qualitative reports, by contrast, are often writing in a more conversational style. Okay, for the statistical information, okay, in qualitative reports, number of statistical symbols may intimidate the readers who do not have the strong mathematical interest or the training. A good of this discussion is to assist you in understanding the content of the research report and in overcoming anxieties about the jargon and statistical information. Okay, that ends our discussions. Thank you for your listening.